All right, let's dive into a really fascinating and honestly often misunderstood corner of psychology. We're talking about the odd and eccentric personality cluster. So what does that label actually mean? And more importantly, what can it teach us about the incredible diversity of the human mind? Let's break it down.
You know, we've all met people we might call quirky or a bit eccentric, but where exactly is the line? When does a unique personality trait become something that clinicians would identify as a genuine disorder? That's really the big question we're going to explore together today.
So officially, what are we talking about? Well, cluster A disorders are all about these unusual, odd, or eccentric patterns in how someone thinks, behaves, and relates to other people. And the key word here is pattern. These aren't just one-off quirks or bad moods. They're deeply ingrained ways of seeing and interacting with the world that are consistent over time.
So here's our game plan. We'll start with a quick overview of this odd and eccentric cluster. Then we're going to profile the three main disorders inside it: paranoid, schizoid, and schizotypal. And we'll finish up by looking at how they connect and what pathways can lead to better understanding and support.
First up is paranoid personality disorder, or PPD for short. If you want to understand this condition, you have to understand that for the person experiencing it, the world is seen through one single powerful lens: mistrust.
The clinical definition really gets to the heart of it. It's this persistent, pervasive distrust of other people. And we're not just talking about being a little cautious. This is a core belief that everyone, or almost everyone, is out to harm, deceive, or exploit you, even when there's no real evidence for it.
And you can see how these traits just feed on each other, right? It all starts with that constant suspicion that makes you look for hidden motives in everything. Then you become hypersensitive to any perceived slight. And of course, you're not going to confide in anyone, and you'll hold on to grudges forever. It becomes this really powerful, self-reinforcing cycle of mistrust.
So how does this actually show up in everyday life? Well, a simple compliment might be twisted into a threat. A friend's loyalty is always on shaky ground. It makes forming genuine connections feel almost impossible, and it often leads to profound isolation. And the tragic part is, it's not because they don't want connection, but because the fear of betrayal is just so overwhelming.
Okay, next up we have schizoid personality disorder, or SPD. And this is where things get really different. The isolation we see here isn't driven by a fear of others, it's driven by a profound detachment from them.
The two big ideas to hang on to here are detachment and restricted emotion. So if PPD is this intense, negative engagement with the world, SPD is almost the opposite. It's characterized by what looks like a lack of engagement altogether.
Now, the crucial distinction here is preference. This isn't about being shy or having social anxiety. It's a genuine, deep-seated preference for being alone. There's very little interest in forming relationships, to the point where even praise or criticism from other people just doesn't seem to land. It doesn't have much of an impact.
And in daily life, this looks like consistently choosing to be alone, picking hobbies and jobs that are solitary. In a social setting, someone with SPD might seem aloof, emotionally flat, and react very little to situations that would make others laugh or cry. It's almost as if that fundamental human drive for social connection just isn't there in the same way. All right, on to our final profile, schizotypal personality disorder, or STPD. And this one is maybe the most complex of the three. It kind of blends the social challenges we've seen with this really unique, eccentric way of thinking that creates a reality all its own.
Notice the three pillars in this definition, because they're key. You have social discomfort, you have distorted thinking and perception, and you have eccentric behavior. It's the way these three things weave together that really defines STPD. So what does that actually look like? Well, it can show up as odd beliefs, things like a strong conviction in telepathy, or superstitions that literally guide their day-to-day actions. Their speech might be vague or wander off topic. Their appearance might be peculiar. But running underneath all of that is a constant, profound social anxiety.
This really gives us a window into their world. A huge feature is something called ideas of reference. That's when you believe a totally random event, like a song on the radio, holds a secret personal message just for you. Or maybe you feel a presence in an empty room. You can imagine if your inner reality is that intense, trying to navigate the normal social world becomes incredibly stressful.
Okay, so we've met the three main players in Cluster A. Now it's time to zoom out a bit and start connecting the dots. What's the bigger picture here?
This is the million-dollar question, isn't it? They all involve social difficulties and isolation, but the why behind it, their internal motivations and experiences, are worlds apart.
This table just lays it out so clearly.
Let's zero in on that bottom row, primary fear. For PPD, the fear is that others will harm them. For SPD, it's not really a fear. It's more like an avoidance of social interaction itself because there's no interest. And for SDPD, it's an intense fear of others' judgment. See? The outward behavior might be isolation, but the reason why is completely different for each one.
So that naturally leads to the next question. Where does all this come from? Well, like most things in psychology, there's no simple, single answer. It's a really complex mix of factors.
Yeah, it's definitely not just one thing. Research points to a combination. There seems to be a genetic link, especially to schizophrenia spectrum disorders. Then you layer on top of that difficult childhood experiences, things like trauma or neglect, and all of that can get amplified by ongoing stress. It's really a pathway of risk, not a guarantee.
And this brings us to what's probably the most important question of all. How do we take this understanding and turn it into real, effective support? What does that actually look like?
Well, even though it can be really challenging, treatment is definitely possible. Psychotherapy, especially things like cognitive behavioral therapy, can help people challenge distorted thoughts. Sometimes medication can help manage really severe symptoms. But honestly, the foundation for any kind of help is the same: building trust, respecting their space, and communicating with patience and honesty.
And that really brings us to the core takeaway here. The whole point of a diagnosis isn't to slap a label on someone and put them in a box. It's to give us a framework for understanding their inner world, their struggles, their needs. It's the starting point for empathy.
Understanding is the bridge that can connect us to people who feel isolated. So the question becomes, what do we do with that bridge? How can we, in our own lives, help reduce the stigma and create a little more space for people who just happen to see the world differently? That, I think, is the real challenge. Thanks for exploring it with me.